Fantastic.
So, yeah,
All
exactly.
right.
We're going off in here with the interviews.
Yeah, and Jarno's already here.
Yeah.
Hello, welcome.
Welcome.
Hi, guys.
Welcome. Thank you for those really great presentations that you gave earlier. And we have some burning questions, but I think I will first start with Elizabeth. She has some questions that she wants to fire to you.
Well, while we're waiting for our last person to get in here, I'd like to start with Jarno. I'm really curious in the application of cognitive psychology in technology, especially when it comes to sort of the shame or the shyness that a lot of us have. You know, you have to be public in order to be cured.
Yeah.
And one of the things, and we're in Sweden, which is also a very private country. You keep your emotions to yourself for the most part. I'm Swedish American, so I keep my emotions to myself sometimes.
Yeah.
But so can you do a little look into the future of where cognitive psychology and technology are going in your mind, or where you'd hope they are?
I think that what we are looking for is my mic on?
I don't think it is.
Yeah.
It is on.
Yeah.
Yeah. Okay.
I think it's more. I'm fascinated about. I'm not myself a psychologist, but we have team of psychologists also over there. I'm the community guy and over there, but I'm almost fascinating how you can take the same elements what you are using in the psychology in the face-to-face meetings to the online environment, how we can use the same tools, same mechanisms, and give our people or other peoples in the world, in the communities, the tools to get better, how to follow them up, and what's the really interesting for us is how to measure emotions. Because if we can measure those, the feelings, downs and ups, and make some learning points over there, then we can create even better tools for the depression or whatever in that sector.
Yeah, absolutely. And then also putting that into the culture that they're coming from. I know in research, they started adjusting for how Americans report their Likert scale because we're too enthusiastic and we're too positive about things.
Yeah, I think it's a little bit mute that the US people are over there. They are also not sharing the stigma is very heavy also over there.
Yeah.
That even so that they are talking about psychologists, but they are not telling the deepest secrets. I think we are more who are able to go to the psychologists in Finland, Sweden, these Nordics are telling more to the psychologists than in the areas over there. So it's
absolutely
it's a huge problem also there.
Well, and what we're seeing in the US is they're enforcing electronic health records for all medical professionals. So that includes psychologists and psychiatrists, which in a system that isn't totally secure is incredibly dangerous for notes on a session. And you don't want to open up and have that in the World Wide Web, wherever it is, for the rest of time. Yeah, absolutely. Okay, well, I think the work you're doing is fantastic, and I absolutely encourage you, and I'm excited. Also, you guys, we touched on something that maybe is kind of a hot topic, the idea that diabetes is really, it might be an instigator, it might be the easy option for getting people in, because we don't have that barrier to entry that we have with so many other patients or people. And one of the things is just, maybe I struck a nerve by saying it's the easy way, but what's wrong with the easy way, right?
Yeah, sure.
Yeah.
I think when you're looking at this particular point, and as I mentioned earlier before as well, is that we all, like the people that are in this venue in here, they all have their personal connection with a disease or something that is wrong with the healthcare system. So when you're looking at the reason why people start up a company is because they see something lacking in the current healthcare system. So from my point of view, when you're starting up a company as someone that is associated to something that is failing or disease, it is quite easy to get into this market because you're so familiar with it already. So you know how to get into your network, you know how to get to your patients, because it's easier also for patients to listen to someone that knows how it goes. So maybe it's true what you're saying. It's maybe the easy way to get into the market, and what's wrong with the easy way to get into the market? And it's also 9 out of 10 times it also proves your success as a company as a whole. But what I found very interesting, and I'm very curious about, this is a question to all three of you, what was for you guys the most difficult part of setting up the company in terms of you're trying to integrate technology into a field that is so depending on face-to-face interaction, human interaction, a doctor that tells you everything will be all right and everything will be okay, don't worry about it. Just that human touch of healthcare. What is the most difficult thing that you guys are trying to address or have been addressing in the startup of your company? I think I will start up in here.
I think for us the most difficult thing was to actually find a proper product market fit. So we started with an idea. We literally started with an idea saying, okay, people are getting sick and you could have prevented that. Like, how do we do this? So to find on the big scale of all the different diseases and all the different things, and like, do you want to keep healthy people healthy, or do you want to have people that already have a condition and keep them from suffering heart events or from dying? That sounds like an easy scales, but actually really, really tricky because it's very, very difficult. It's like very different. So if you compare like diabetes to a heart attack or bipolar depression, there's nothing in common. There's absolutely nothing in common. And you still have to apply, like, to some extent, you are bound to the technology that you have. So like how to make this fit. So I think for us, the biggest challenge was to structure that process, and it took us a year. So like it took us a long time to basically say, okay, what are the most critical questions? And then off we go. So let's interview 100 patients. Let's interview 100 doctors. Okay, we don't seem to solve a problem. Then let's put like bipolar depression with sensor devices on the trash. And let's go do the next thing and cross them off the list until we have a fit. And try to like don't get demotivated from that, and like keep learning, and like just accept that this is part of the process. So I think it's hard because at the same time you have to raise money, you have to run out of money, so you don't want to tell people like, yeah, there's 3 things like we spent 5 months on, but it doesn't work. Right, so it's like I think that's the hardest thing. So like I used to work in gaming. In gaming they call it killing babies, because you get attached to it to some extent, right? You like spend some time working on this idea. You do some mock-ups. You have an app. You like it. You yourself like it. Then you have to realize people actually don't like it. Then you have to throw it away and say like do something new. I think this is extremely hard. And I wanted to add one thing. I would protest saying that like what we're doing, taking with diabetes, is easy. So I would say there's like one successful diabetes player in the digital world, and it's like MySugar, or maybe 2 with glucose. So it's 2 out of, I don't know, 950 apps out there for diabetes. And like, I mean, Google hasn't come up with Google sunk billions into this, haven't come up with anything proper smart. There's huge companies like Watson did something that, like, in my opinion, also is like not something that actually solves the problem. So like maybe it's the easiest to get into, but like maybe it's not. But like I would just wanted to add this note that it's like I don't think it's like that easy. I don't, in my day-to-day life, I don't feel like we're doing an easy job.
There's actually a big struggle going on in the field, and that maybe that's also because what I mentioned earlier is that a lot of the patients are about to get tired of technology because there's going to be so many introductions of new apps,
and they are making our lives harder, right? So there's like so many apps that are absolutely useless. So like you have somebody that you could encourage for technology, you have a chance, and then somebody gives him like an app that like is absolutely doing nothing or giving him very shady suggestions, and then the person puts down the phone.
Exactly.
And like let's see if he picks up the phone another time to trust another app. So like we're not really benefiting from this process. We're not benefiting from like so many apps being out there in that space. Like I don't feel that way.
No.
Sorry, what was the question again?
What was the most difficult thing in terms of what you have to handle?
I think we're still in the phase because in some ways, because we have this idea in our company that you have this great new technology, no matter how good it is, and then you have still people, and we really think that you have patients and then medical personnel, and there's a lot of discussion like, are we going to need doctors in the future, and do we need nurses? I think we do, and I think like specialized healthcare personnel will be even more important than ever. And for us, we're still trying to figure out what's the best way to bridge that gap. Like you have this great technology in the middle, and then you have the patient and the healthcare personnel, and how are they going to communicate, use the service, like what kind of features it should have to bring out the best kind of service. so that all parties win.
Yeah. One of I had a conversation earlier with someone that was a presenter here as well, and one of the things that they mentioned was that a lot of the healthcare personnel feels like digital health is a replacement of.
Yeah.
Do you feel that when you're talking to medical personnel like diabetic nurses or endocrinologists, that they have that same attitude when it comes to your
No,
situation?
like I said in the talk there, we've noticed that there's a change in the healthcare industry, and that doctors and nurses are actually, they're pretty interested. Like there's genuine interest towards it, because they realize that there's a lot of diabetics and there's not enough resources. They have to come up with new solutions, and now doctors and like the healthcare personnel, they're tech savvy as well. So they know how to use smartphones, and they understand the world, and they see the benefits. And so no, like we were actually a little bit surprised in the beginning, but the response has been very good.
Great.
Right.
For us, it has been always the key thing is a trust, and we see that Heimo is not just finding friends. Heimo is a friend. So how to communicate that with the design and every small things, communications, creating the trust from the beginning that they hear about us, and the end of that they are able to share their inner thoughts over there. So we are seeing that they have to trust in Heimo more than their friends, if they have friends. So it's not the technical things. It's nothing. There's tens of millions of social media services that might be same as Heimo, but it's about what kind of culture you are creating in that service. So how to communicate that, what we are, and get people to tell it to others also. So that's always the thing that we are daily basis, not struggling. I think that people are taking Heimo care and telling it to others also, but that we are the friend. And always, because we are also a tech company, we fail sometimes. The connections might be bad or we are slow. Then we say, we apologize that we've done that, but we are still, you can trust us.
From what I understand, your service, the product that you brought to the market is primarily a communication depending tool, because you rely a lot on how a patient interacts with your service. When you're looking at the problem that a lot of patients are facing with building up a wall, talking about their problems, talking about their disease, do you experience that this wall is non-existing in digital way, or do you experience that they still have that same wall, the emotional wall of not wanting to talk about your issues or your problems or your feelings?
I think it's there's more low threshold, but one thing, that they don't know that they are patients. We don't use patient word anywhere, because I have a problem. I don't feel that I'm a patient. I'm just have troubles. So that's also the key, that we are talking about patient. But overall, I think it's always that way, that people are go on online, and that's why most of users are anonymously there. It's different, definitely there's lower threshold to tell the things, and that's also one of the key things, that how to build this anonymous online community where you don't have trolls coming there. But yes, definitely, I have shared one of the stories that in 30 years I haven't been able to tell to anyone, and I know many other cases that they has told that the only place that I've been able to tell is in online, over there.
So it creates a little bit of a trust feeling around. That's interesting.
And the people are creating the trust field. The others who are really emphatic and giving the trust to others. So that's the key.
Okay.
Yeah.
I don't know if you have any more questions.
Well, I'm just seeing. I was thinking about what you said about the dilution of the market and what we're seeing in terms of creating digital health as more of a 24-hour support and a tool, and something that we use a lot, whether we have some emotions we need to share, whether we need some health we need to regulate or check, and using certain things like the first kind of cognitive psychology and social sharing platform as a catalyst, just as while the market is diluted in the diabetes sector, but using that as a catalyst for the other diseases that need to be managed on a daily or regular basis. And I think it'll be interesting to see what really is the catalyst and how we're pushing this through, because I have a piece of technology on my wrist was invented at least 3 decades ago, and we all need something to push this through. So I've asked this before, but what do you guys think it's going to be?
I have to say, I think it's going to be diabetes.
Yeah?
I think it is. I think it's right now. I think the industry is before being punctured to the next level. So right now, I mean, I have a Apple Watch as well. I'm not using it because most applications on it are not useful, right? But like I'm not until the moment where somebody will tell me, "Hey, wear this," and when you get a stroke, we alarm you a week earlier. Or if you have diabetes, and this would be something I would say, okay, like bring it on. I will use it and will use it happily. And I think it's going to be close that diabetes will do this. So like I think like the first providers that like doing the continuous blood glucose monitoring are bringing iOS apps and watch apps. So I think there will be something that will give you actual alerts, warnings, and actually help your life, make your life easier. So I think like once you have like this one flagship, the technology on your wrist is preventing you from A, B, C. I think more will follow because you will have role models and you will have established paths. So right now we're just like waiting for it. Apple's also waiting for it, and they push the community to do it. We saw that they pushed the community to do it because they opened up more opportunities to use from the sensors. So like right now, I mean, you have a GPS standalone module on the watch. You have like a lot of things that you can like access in the background. So I think it's going to be like it's not going to take time until it's actually valuable.
And do you think it's the individual monitoring, or do you think maybe it's the children of the baby boomers, for example, who will put it on the wrist of the elderly, that kind of thing?
I think it's going to be the early adopters first. So I think it's going to be the people that have it's going to be the section of people that have the biggest problem that's actually like continuously going on and like are more prone towards using technology. So that's why I think it's going to be diabetes, because the way we experience, like, I mean, you have a lot of 20-something-year-old diabetes hackers. It's actually hackers. You have those devices and they hack the device that you have. So those are people that are really pushing for a solution. Like my granddad, who might be a great patient for that, he's not pushing for a solution. So I think, and it's also harder to sell the solution. So like it's harder to find the first 10,000 people say like, yes, this is amazing. So I think I see a lot of potential in diabetes.
Okay. Well, what was said earlier today? Hackers, hustlers, and hipsters?
Hipsters, yeah.
The future of digital health.
That's a good one.
I think it's perfect to
The
leave
holy
it just
triangle.
there. Yeah. Thank you guys so much. Good luck.
Thank you.
And
Thank you
very much.
keep going.
Thank you.
Thank you.
Yeah.
Thanks.
Good luck with everything.
Thank you.
Thanks.
Thanks.